Okay, now we're going to go over lumbar exercises, which mostly is done on the wobble chair. So you're going to have the patient step forward, come around here in front of the chair, and before the patient sits down, you want to make sure that you illustrate that this chair wobbles. So when you sit down, I want your hands to be on these rests so that you don't fall out of the chair, okay? Hands back on the rest and sit down as you're holding on. Very good. All right. So now that the patient is in the chair, we're going to go through these exercises. The first exercise is called hip dips, and you do the hip dips with the hands down on the rest first, okay? The hip dips look like this. Dip the hip to the left, and you dip the hip down to the right. What you don't want the patient doing is this, okay? Because then you're not getting any movement in the spine. The upper body stays relatively still. You're going to get some movement in the upper body, but not a lot. Most of the movement is supposed to be in the hips, like this and this. So show me that exercise. Good. And you'll have the patient go as deep to each side as they can go. Okay? There you go. Almost as if they're trying to bottom each side out. Good. All right, and that's called hip dips with the hands down on the rest. Okay, number 2 is called hip dips with the hands up. So simply take the hands off the rest, and this is just going to challenge their balance a little bit more. But their hands are right here, that way they can grab the rest if they feel like they're going to fall. Okay, so it'll be the same motion, hands up. There you go. Good. Show me a few of those. Good. You see how most of the motion is down in the hips, not a lot of upper body movement. Okay? Number 3, we call it hip dips with the arms like a genie. So the arms will be like this. Right? We bring the arms up to get a little bit more stretch and mobility higher up in the spine. Okay? So the same movement, hip dips, with your arms up like this. Okay, let's see it. Good. Again, having the patient dip as deep to each side as they can dip. Good. All right. The next exercise, same movement, hip dips, except the hands are behind the head. Go ahead and put your hands back here. Do not lock your fingers, okay? Because if they fall, or if they feel like they're going to fall, it's harder to get your hands down. So just overlap the fingers, okay? There you go. Keep the elbows out, and then the same movement. Okay? Most of the movement down in the hips, as deep to each side as you can go.
I was like,
good.
Oh, I'm still thinking of David right now. He's not liking me too much right now.
All right. Good. Number 5 is called pelvic tilts. Pelvic tilts, you do first with your hands on the rest again. Pelvic tilt, instead of going side to side now, we're going front to back. Okay? So when you go to the front, you arch your back. When you go to the back, you round out your back. Okay? Let me see you do that. Good. Again, most of the movement being in the hips. What you don't want them leaning forward and then leaning backwards. Okay? That's not the exercise. Hips roll forward, arch the back, and then hips roll backwards, and you round out the back. All right? Very good. Number 6, same movement with the hands off the wrist. Okay? Go ahead, frontwards and backwards. Good. Give me a little bit more tilt towards the back there. Good. And if they are really having trouble or struggling with their balance, then you as the therapist or the assistant needs to be right here so that they don't fall backwards out of this chair. Good. All right. Very good. Number 7 is called circles. Okay. Hands down on the rest, and simply just make big circles with the chair. Okay. There you go. And when your hands are on the rest, you can have the patient make really big circles. And they'll do however many repetitions they're supposed to do on that exercise. Good. Then you also do circles with the hands off the rest. Okay? Challenging the patient's balance. Okay? They may have to make smaller circles with their hands not on the rest. Okay? But that's okay. Number 8 is called squares. All right? Simply draw a square instead of a circle. Okay? Across the front, to the side, across the back, down the side, across the front. Okay? So we're just sharpening the edges here. Back, back, front, front. Okay? Just like that. So you do that. Good. And you're going to do that same motion without your hands on the rest. Okay? Again, you may have to make smaller squares, but you can still draw a square with the chair. Okay? Good. Very good. And number 9, which is probably the most challenging, is to draw a figure 8 with the chair. Okay? So it's just a shape that you draw in your mind as you move the chair. Okay? You make a figure 8. All right? Hard to see on video, but if you can picture a square and if you can picture a circle, you can also picture what an 8 looks like. Okay, so you're going to be making this motion on the chair. So, do you think you can do that? To the front and then to the back. Good. Front and to the back. Very good. And then you can also do that with your hands off the rest. There you go. All right. Again, the purpose of these exercises is not always to do them perfectly, but to challenge the patient's balance and to make them move their lower back in many, many different ranges of motion and planes of motion. Okay? So if they're not doing it perfectly, don't fret. As they practice more, they'll get better. As you practice more, you'll get better. But at least we're getting them done. Okay, so that's the wobble chair lumbar exercises.